Hello, I'm Catherine Phillips and I've been working at Time for Me of Kenilworth for the last 10 years, and we do clinical reflexology and Bowen technique. And today I'm going to just quickly use this miniature skeleton to sort of give you some general principles behind what we're aiming for when we're doing Bowen therapy. Because a lot of people think that Bowen therapy is some kind of woo-woo-y something that isn't actually doing anything, and then when they don't feel very much during the treatment, they assume it's because I haven't really done anything. Okay, so to look at this skeleton, which is sort of anatomical, it's quite a useful basis, because what it tells you is you have a rib cage here and a pelvis here. But in fact, some people's rib cage comes right down here and some people's pelvis comes right up here. And you could have no space here or here. And that will mean the person has difficulty bending sideways because the two sets of bones will hit each other. And in the arms, we have two bones here, which as we twist our hand, they should be free to move. But often when people are sitting on the computer like this, they end up with these muscles on the inside here, which are actually controlling the hand, tightening up, and sometimes even all of this section tightening up so that the bones all end up in like this, and these muscles here become extremely tight and the hand is curled, for instance. Okay, so what we're looking for is which areas of elastic bands on the body are tightening too much. If somebody sits at the computer, but they allow this piece of the pelvis to slouch back, this section of the spine, instead of bending inwards, will slouch back outwards. So then they'll be slouched out, and just imagine my hand now is the new location of the pelvis and the spine, this section of the spine. Then the ribs become rounded, and you end up with one big bulge, and then the head on the front cranked down. And the weight of the head, every 10 degrees forward, massively adds to the load, which is then being cantilevered here. And the more the head is forward, the more it will go forward. And so all the time we're looking for that. And similarly down here, we're looking for the angle of your feet. Because if your feet are inwards, so if the feet are over here, it could mean that the pelvis is twisted, or it could mean that this one leg, because somebody routinely crosses their ankles or their legs, they routinely tighten this side or this side of their leg, and therefore their foot is turning inwards. So one is correct, one is turning inwards, but it's nothing to do with the pelvis. And when that foot turns inwards, you're loading wrongly, and that is the subject of a different video, which you will be able to click on. Equally, when some of these loadings get misaligned, if you can imagine the foot's twisted in and collapsing in, it means, as you can see here, that the knee joint's becoming distorted. If you take the legs and cross them like this, you can see that up here, the hip is being put under stress, or this hip's being put under stress. And if somebody uses both their legs and crosses them really viciously, then not only do they risk effectively partially dislocating their hips, but they're also starting to break down the integrity of what are called their sacroiliac joints here. And they're twisting either one ilium or the other against the sacrum. And when they are then in that twisted state and choose to stand up and attempt to walk like that, they start to cause more problems. Think foundations of a house, think foundations of a bridge. Think of the effect of the foundations of your body not being correctly aligned, and then the impact that has on the whole structure above, of which, for instance, just in the spine alone, there are 26 vertebrae, plus these fused vertebrae here and the coccyx, which is a set of separate bones. So that's just one section that can be misstacked. As soon as it's misstacked, for instance, if you're constantly tight on this side, and it could involve being bent over, or it could be less obvious, what can happen is the fluid discs that are between these can end up bulging the opposite side, and that's your prolapse disc, which often frightens people, but it often doesn't need to. We're working soft tissues. So what we're doing is imagine the Eiffel Tower with elastic bands on all the structures. We're assessing which elastic bands are causing the Eiffel Tower to be bent and squiffy, held squiffy. And we are influencing those soft tissues, saying to the body, please change. And we're sometimes leaving the room because we've realised it's not changing, and when we come back in, we're checking to see if it has changed. So when people come out and they feel a lot better, there is a reason why they feel better, and we're watching it happen on the couch. The same thing happens up here with shoulder blades. Sometimes we've seen people with a shoulder blade up here and another one right down here. It can be, 15 centimetres difference between the two tops. And during the course of the tensions, because bear in mind this is a critical part of your shoulder structure, as the soft tissues stop pulling things, because we're not crunching any bones, we're reducing the tension. As we get rid of the soft tissue tensions that are holding one up and one down, they have the ability to correct themselves. Suddenly people have massively increased and improved movement in their upper body, and they think, whoa, that's a bit weird, but it's not. It's purely biomechanical. So I hope that's a very quick lightning tour. We're going to talk in more detail on separate videos about TMJ, so your jaw and your neck and how this all integrates together. We're going to talk in more detail about the pelvis, we're going to talk in more detail about the foot and about the knee, and those kind of building blocks will help to give you some idea of what we're about.